We had a case that we've been recently dealing with. Her name is Maggie. She's a middle-aged Chesapeake Retriever, and she ended up coming in with acute lameness of her right hind leg. Owners weren't sure how it happened, thought maybe when she was running outside that she might have turned the wrong way. She came in, she had an assessment done, and we determined that she had some swelling around her knee, and we did a couple of orthopedic tests, and we felt that she needed to have x-rays. We took Maggie and had x-rays under sedation, and we were able to appropriately diagnose her with a chronic cruciate tear. So we did see some changes within the stifle that had been going on for a period of time. Even though it appeared acute, this was more of a chronic case, and she probably had some lameness at a previous time and maybe had a partial tear of her cruciate, but at the time of presentation she had a complete rupture of her cruciate ligament. And she was, mildly weight-bearing, but she was definitely in discomfort. So, and we talked to the owners about the plan for her. We put her on some anti-inflammatories to give her some pain control, and we also had her restrict her exercise because of the instability in her joint. And when patients have that instability and they continue to exercise and walk around, they're going to actually create a lot more arthritis in a very short period of time. Most often we will see a patient that will have an acute injury to the cruciate, and within a month we will see radiographic changes that there's arthritis present within their knee. So we want to really minimize these animals from moving around after we have a diagnosis of cruciate disease. So the next thing is to try to get her into surgery as quickly as we can, and that's one of the things that we aim for, try to have these patients in within a month of the injury being diagnosed. So today Maggie came in and we did a TPLO surgery, which is a procedure where we rotate the angle of her tibia to make it a more level plateau, so that her femur isn't kind of sitting down a slope and sliding off. Now it's kind of sitting more upright, and this stabilizes that stifle joint or the knee joint and makes her much more comfortable and doesn't give all that kind of swelling and pain within the knee. At the same time, we went in, we explored her meniscus, which is a little bit of kind of a cushioning between the femur or the thigh bone and the shin bone, to make sure that there's no tears in that, and we addressed them as appropriate. And then we went and we did the procedure. The procedure involves, like I said, making that incision into the tibia through a kind of a circular incision, and then we put a bone plate in to stabilize that bone as we rotate that angle. And she did very well during surgery. She did very well after surgery. She's nice and comfortable. She'll go home today on pain control, which includes a variety of different medications and some antibiotics. And we'll see her back in a couple of weeks, which at that time I would expect her to be weight-bearing. Most of these patients are starting to walk within a couple days after surgery. So the recovery time is prolonged because the bone needs to heal, and bone takes about 12 weeks, and the older they are, the longer it takes. So we're expecting the bone to be completely ossified and calcified within about 12 weeks in Maggie's case, and at that time we'll be able to instruct the owners about what we can do for further exercise, if there are going to still be any restrictions, and make sure that there's no evidence of any complications post-surgery. These surgeries do have some complications associated with them, and these complications in the majority of cases are very minor and don't require a second or a revision surgery, just might be a little bit more restricted on their exercise and maybe prolonged medications after surgery. So when Maggie first came in, if we decided to not do surgery and do a conservative approach, her prognosis would be that she's going to develop significant arthritis as the years go on, to the point where she's going to have quite a bit of mobility issues, and that's going to affect her quality of life. So surgery is the number one treatment for Maggie, and with doing this, we're going to get her back on her feet fairly quick, where she's going to have about 95% of her normal mobility before she even had an injury. So in her case, the osteoarthritic changes will be less than what they were if we didn't do surgery. So that's going to help, quite a bit going forward. She should have a very comfortable life. Concern obviously is what about the other side? So Maggie is a little bit overweight, and so we will work with the owner with a nutrition plan to try to reduce her weight, and also an exercise and a physical therapy plan too, so that we can try to minimize the chances of this happening on her other side. And majority of cases, 50% of the time, they will go and they'll rupture their other cruciate within 6 months. So we make sure that the owners are aware of that, and we do everything we can to try to minimize that from happening in the future.